This is the Medical Brief, powered by Surgeon. I'm Vahid Sadrzadeh, with Doctors Jeremy Heffner, Dr. Ankit Patel, and Dr. Brian Schmutzler, coming to you from all over the Midwest. Jeremy, Dr. Heffner, we'll start with you. Kind of explain to us what Surgeon is, the platform, and who it's built for.
So Surgeon was designed about 5 years ago by myself and my two partners. One is Dr. Mario Leba out of Albuquerque. The other one is Dr. Mark Solomon out of Florida. And what we were trying to develop was a platform for medical professionals that was taking the best attributes of Instagram, Facebook, Twitter, YouTube, all of these platforms, and put them together in one place so that medical professionals could have conversations, debates. We won't say arguments because we tried to keep it collegial, but real conversations, the more raw and real conversations that we really can't have anywhere else in the world. And with that, we want to educate each other, train each other, teach each other, because all of us have different perspectives. There's not a stupid doctor. There's not a stupid medical professional. There's some might be lazier than others, but realistically, we're all seeing the world from a different perspective. And we really need to get all those perspectives and have the opportunity to discuss what those perspectives are teaching us and how we can teach each other from what we're seeing in the real world. On top of that, we want to have a place where we can be a little more honest, a little more open, a little more real, because in the outside world, people are always watching. Your patients can see you. There's somebody's going to judge you. But we had to be behind closed doors in a place where you can say, this is how I actually feel about what's going on, and this is what I'm seeing, and how can we make this better? And overall, it's all about elevating not just our lives as physicians, as medical professionals, but it's also really elevating patient care, making it better. We started in the United States. We had 13,000 U.S. surgeons, other medical professionals in the United States, and just recently we went international. So now we're in the UK, we're in Canada, we're in the EU, and as this year goes on, we're going to roll out across the rest of the world. This is going global, but we really just want to remember that the foundation of this whole thing is to have the conversations you need to have to make this world better for not just the medical professionals, but all the patients that we take care of.
And how did you move it from, an idea to partnering with Intuitive and turning it into Surgery Unified and this kind of big product that we have now?
Yeah, at first it was just three guys trying to figure out how to make an app. And it seemed like, obviously it was going to be a big lift even from the start. We weren't stupid. But as we moved through it, we understood that it's about finding all the connections. We initially was about surgeons, but it really isn't about surgeons. It's all the things that relate to surgery, that relate to proceduralists, all the connections of the different players in the operating room. So we wanted to get the understanding of the anesthesia, pathologists, radiologists, the nurses. Nurses are going to be brought in at some point. We have a lot of mid-levels involved. And even to the point where we're probably going to have some corporate executives involved. But on top of that, we understand that device companies are part of this too. I always say that we're just the tip of the spear. I can't sew without somebody making the sutures. I can't staple without somebody making the staples. You guys can't put people to sleep without the gas. So we need to have those engineers, those designers as part of this conversation as well. And how do we create a place where we could really collaborate and have long, in-depth conversations of what we need, because they don't know what we need, they don't know what to make. And that's also part of it. So we've really worked to develop those relationships. So it's not about the confrontational company. Sometimes when I was in some of the academic centers and places I've worked, it was almost like it was confrontational with them. It isn't. We're all on the same team. I think we're all trying to make this world better. We're all trying to help each other. We're all trying to help the patients and really be successful in these operating rooms so the patients have good outcomes and we get to go home at night and not fret and not worry about what's happening to them. And that's just going to require all these conversations.
Yeah, Dr. Patel, we want to move to you. Joining the Surgeon team and now kind of starting this podcast. We're excited about the year ahead and who we're going to be talking to. And you're kind of plugged into the medical community and the leadership and the thought leadership community around the United States. Tell us a little bit about kind of the idea for the podcast and who we've got coming up this season.
Yeah. So initially, I talked to Jeremy. He and I worked together here in Lima, Ohio, actually. And so my idea was we have this platform. We have all these providers that we have access to. We've got this strength of numbers. Why can't we create a show where providers like ourselves want to go and listen to the key leaders around the U.S. who are making those medical decisions for us or on our behalf, and just have a conversation and get to know them. A lot of the times we are members of these major organizations, but we don't know a lot about what their initiatives are, what they're working on, or who the people are. And so I've connected with a lot of providers so far where we get to learn, and we've done some really good work where we've learned about the person, their pathway to becoming chair or the president of a certain society, and really get to know the plans they have in place for us for healthcare, and kind of talking through the healthcare thought leaders, innovators, changers, movers, and shakers. And so it's a fun year. It's a fun year ahead. So far, we've got the AMA president, past and current ASA presidents on the docket. The Surgeon General is coming up here soon, and a lot of other healthcare leaders.
Former Surgeon General.
Former Surgeon General coming up. And we have a lot of big names coming up here that will be very interesting for us as listeners to get to know.
Yeah, and I think our big goal is to make this educational and fun, and bring these thought leaders, bring these innovators, bring these high-level professionals on to be able to talk about things that are important to them, but also to give them a bigger platform than, that they necessarily have at, the ASA conference, for instance. A bunch of anesthesiologists are going to listen, but not the surgeons, right? And just like you talked about, Jeremy, the big thing is we want to connect all these different professionals who work in in medicine in general, but in the operating room in specific. And also give them a platform to get out to the wider community. It's not just that, everything's going to only be in the operating room, only with other physicians. This is going to grow. And I think that's probably your vision too, Jeremy, is that this grows where people even outside of medicine, outside of the operating room, are getting to hear from these very, very important and high level people. So
yeah, and collaboration is the key, right? I mean, we all talk about it. Collaborating within other physician groups, outside of physician groups. That's the way we strengthen numbers, right? So we all collaborate together to make the changes we want. But for the longest times, we've all worked in a silo. I work in my silo of anesthesia. Jeremy, you work in your silo of surgery. And until we break down some of those barriers or the reasons that there's barriers, and then we start working together, that's kind of when we actually make real change. So that's what I'm excited about. I think Brian, you and I have talked about this for a long time. We're excited about the changes that can come ahead once we collaborate.
Well, and you're wondering go ahead. Go ahead, Dr. Heffner.
Yeah.
No, I think you said it right. It's going to be bigger than just our audience currently. I think that the general population, there's a lot of good information that's going to come out of this, really understanding the point of what I say, bureaucratic medicine. A lot of these interviews are going to be with thought leaders that they're thinking of things from a 30,000-foot view. And sometimes even in our own roles in these operating rooms, in these hospitals, we don't understand why they're making these decisions or even what decisions are being made. And the general population really is even further removed from it than we are. At least we're in the system. And so I think understanding their way of thinking, how they think, why they think that way is going to be a huge asset, not just for other professionals, but across the wider audience.
Yeah.
And you're wondering why I'm in this silo and what silo I'm coming from. But very important. I think, Brian and I have worked on podcasts for a couple of years now together, but my background is Emmy award-winning journalism. And so I think it's important for not only you guys to be in that conversation, but what are some of the questions that us non-physicians have for some of these thought leaders and some of these medical professionals? And I think something that I've learned over these last couple of years is, maybe I can be the voice for those people who are not in the room, and ask some of those questions that,
we take for granted.
Right.
I mean, we sometimes go back and forth on that, right? That we take for granted that everybody knows what X, Y, or Z is. And
I don't.
Not always. Yeah, right.
And so to get in these conversations and to maybe ask the questions that maybe you guys take for granted and maybe you're not thinking of. And so it's great to be in these conversations and to ask those questions, and go behind the curtain as it is, because ultimately we don't really want this podcast to be for surgeons, for physicians, right? We want it to get out to the general public to hear these conversations that we're having, because, listen, even the AMA president that we will be releasing soon, talking with the current AMA president, it's just so fascinating to hear his story, to see what he's been through, what he's going through, what the direction of our medical industry is becoming in 2025. We talk a lot about AI this season. Yep. We talk a lot about COVID-19 this season during this podcast. And so, to get behind the curtain and get behind the scenes, I think it's invaluable information that I'm not a physician. I'll openly say that, but to ask some of these questions that maybe people have questions to that are not within the group.
Well, because, like you said, a lot of the work that these organizations do is directly for people that are not in healthcare, right? For our community, our country as a whole, that's our patient population. That's what we're doing it for. It's really them that we want to get these kind of messaging out to.
Well, I think there's so many conversations, circulating around COVID-19.
Yeah, I think
right
that'd be a
now,
big part of our season.
AI and COVID-19 not working together, hopefully. But, COVID-19, so much has come out in the news. Again, chime in, guys, about this, but so much has come in the news recently about this. Let's touch it at a high level here during this even first podcast. How has our world changed over the last 5 years? Where is our world going because of the after effects of COVID-19? What were we fed? What could we believe? What should we believe? Is there anything to believe? Right? Those are some of the questions that the general public has about COVID-19.
Yeah.
Well, the biggest thing
Jeremy,
you raise is doubt. The doubt is out there now. So it's the biggest thing that came out of it. It's we don't know what to believe. We don't know what. Right. We just don't know anything.
Or who to believe, right?
Yeah.
Or who to believe.
Right. There's too many questions.
Jeremy, you ran the COVID response. So just a quick maybe delve into, I know we'll talk more about it later in the season, but delve into sort of your experience just real quick so we can get that out there.
Yeah, I know it seems kind of odd, I think, that we're talking about COVID 5 years out, but I think that's why we're talking about it. We're now 5 years out. We weren't allowed to talk about it for a certain period of time. And I think we're just getting to the point now where we need to really retrospectively go, okay, what happened? Because I know, as you just said, I was on the front line for my hospital, a pulmonologist myself. My background in critical care as well. We ran our response, and it was eye-opening to see, one, the mismanagement of the whole thing and the politicization of the whole thing, because we got to a point quickly where we couldn't trust anybody. We had major studies in the Lancet getting withdrawn because they were completely made up. That's never happened. And if you talk to most people, the general population doesn't even know that happened. And even in medicine, I talked to other doctors, they don't realize that's what happened. And there were drugs that were put off the market until we couldn't use that were all in studies that were actually just lies. And yet, how are we supposed to trust these CDC, these FDA, like all these major
NIAID?
Yeah, these major bureaucratic organizations. I worked at NIH for a period of time back when I was in training, and so I've been to these places, and it really changed my view of all of them, because they were obviously becoming political in a time, the least likely time that I thought they would. When I read stories of you reading books about previous pandemics, it didn't talk about that part. It didn't say that it was going to be completely twisted by the media, or it was going to be completely twisted by how the politics at the time was affecting it. So I really think that we need to be able to pull that curtain back and say, okay, what actually happened? And we're starting to get the pieces through, but it just, we've never been allowed to have that conversation and say, okay, how do we handle this next time? How do we prevent this from happening? And one of the things, I'm just going to throw it out there, one of the things is we need a more robust group of people who can ask those in charge the real medical questions and know when they're not telling you the whole story. Part of the problem with our media was it was that sleight of hand. You could say part of the story and the media didn't know to say, but what about this? That you're leaving this part out, because obviously
they didn't bring any physicians in. Yeah, right. Exactly.
Yeah. Well, it was, they pushed out.
Right. From my perspective, because I was behind the anchor desk for most of COVID, trying to get behind the curtain, but you didn't know who to bring on, who had the information. Yet we had somebody from the county city building in our city who was the spokesperson for this, that we were fed the information to. Oh, you want numbers? It's coming from the county city building.
Yeah.
Okay.
Just believe it.
Sure. Do I have to go to a city meeting at 7:00 to get the numbers? Like, what, where is this information coming from? Who are you getting your information from? How do we know that that's truth or not? So it was, you're right, Jeremy. It was interesting to kind of be on that side of it. Well, you guys were being told one thing, we were being told something else by. He's not.
Not a physician, that's for sure.
Right. Yeah. So we're being told somebody by the city who is giving us information.
Do you think though we were just we were really information hungry at that time? 100%. Every third day we were so information hungry that we were maybe just more compelled to believe what we were fed. And I think we were looking for some kind of a magic bullet every third day, some new change that was going to help us get out of it. And I think to some degree, I think the information we got was what we got based on the knowledge that those people had. But at the same time, I think we were also so information hungry that we just bought it.
But they didn't say it's the information we had. That's my biggest problem. They didn't say, we don't know, but we think. Like Fauci never came out and said, we don't know, but we think you don't need a mask right now. He came out and said, point blank, you shouldn't wear a mask. It's not going to do you any good, blah, blah, blah. And then 3 weeks later, oh no, everybody's got to wear, you go to the grocery store, you got to wear a mask, right?
Yeah.
So you just come out, you have to be honest. We're not really sure what's happening. We don't know if it's airborne, we don't know exactly how it's spread, right? I mean, that's the issue I have more than anything.
Yeah, I would trust more of the ability to say, I don't know.
Right.
If someone were to say, I don't know, but it could be, I would trust that versus the adamant, it's this. You got to do this.
Right. I think even more than that, I mean, what you're saying, that's true. But by day one, we had experts already supposedly claiming that they knew stuff. There's like people literally getting on and they're like, well, here's this. And you're like, how do you know this? Unless you were in China for the last 2 months when it started, you have no knowledge of it. And you're coming up and screaming like you're an expert. And we were buying it, and it blew my mind. But even more than that, I had the luxury of being behind the scenes for a lot of things. I mean, at a local level, but I was in closed door meetings before it all came out, as we were trying to figure, and it's like, hey, we have 50,000 masks coming over from China. That's it for the country. We have 2 days supply sitting there, and we don't know if this is going to kill 2% of the population or 10% of the population, but we expect a massive mortality. And what people don't know was when the Imperial College study came out, which was in mid-March. There was a study out of the Imperial College of London, and it basically said, Neil Ferguson study. And this is one of those things that I've asked a lot of people over the last 5 years if they knew anything about it, and they didn't. And it's like, that's actually what drove it all. And we really need to discuss this because he comes out and he says, if for anybody that read the study, I think both of you probably did, but if you read the study, it was the most scary thing I've ever read in my life. And so it gets released, and I sat down, I read it, and it was basically saying that there was going to be hundreds of patients for every hospital bed across the entire Western Europe and United States. It could have been the downfall of democracy. I mean, and that's why they were so freaked out. I mean, that's why the politicians were freaked out, because if you read, I literally sat it down, picked up a beer, and just went, oh my God. Like this is
and he also predicted like a 20% mortality, right? Or 20% severe morbidity, right?
And what was it? What did it end up being?
Less than 1%. I mean, 1.2% or something like that.
And that's what happened. So by the time, but then that study comes out, and by April, here's the part that drives me nuts. By April, he came out and said they tested all of Iceland. Now, at this point, we didn't have tests yet. That's a whole different conversation. We still don't have testing. But Iceland, they tested all of Iceland. And he comes back out, Neil Ferguson comes back out and says, it turns out the R value, or the number is much lower than we thought. The subclinical spread is higher than we realized, and it will put some strain on multiple systems, but we should be able to tolerate this with our current abilities and capabilities across all of Western countries. What? That's April of 2020. He says that.
Wow.
How many people
that never got released? Yep.
Never gets out there. Never gets out there. And that should have been at that moment. And by the time we get to September, we're way ahead of what we expected in terms of mortality. I mean, like maybe a lot less deaths than we thought. We were expecting, I think, 3% by that point. And everybody, but yet the world's screaming, "Oh my God, all these people died." It's like, actually, we're doing way better than we thought. Like this is not where we expected it. And yet that's not the narrative you were hearing. And that's where the politics really took over. I think became a problem.
There was a lot of fear mongering was a goal of some.
Are people hook, line, and sinkered yet? Because that's the conversation that we are going. That's the ultimate teaser of the conversations we are going to be having on this podcast this season.
And Vahid, I just want to note, like, I have a background in bioengineering. I've done viral research at one of the top children's hospitals in this country. Like when this came out, it was obvious it was one of two sources. It either came from nature or it came from the Wuhan lab. And people need to understand that Wuhan lab, it discovered more coronaviruses than any lab, all the other labs in the world for the last 10 years. But those viruses don't come from that area. They come from 1,000 kilometers away. And yet they're acting like it. So it's like an oil spill next to a refinery. And people are like, but obviously it's not from the refinery. And it's like, but actually you have to include that as a very real possibility. Now you have to look at both options. And you have to, but you can't just immediately disclaim that that's not it.
Right.
The mathematical
people didn't want to
odds
believe it, right?
Yeah.
People didn't want to believe it. They were like, "Oh no, it can't come from a
because somebody ate a raw bat. Right,
a just bat, last week,
right?
Yeah, just last week, CIA comes out and says, "Yeah, probably can't put a lab."
Yeah, exactly.
But it was obviously like an option.
Are you guys excited for this? Man, we're all fired up now. I mean, we've got plenty of we're just scratching the surface here, which is phenomenal. As Ankit said too, I mean, we've got so many great guests on this podcast, from the current AMA president to
current and past ASA,
and future. And of course, we've got high-ranking officials that are going to be joining us on the podcast as well. And we're going to have this discussion about COVID-19. We're going to make a little series of it as well, right on this podcast. So I'm going to kind of just go around here briefly before we wrap it up here with this first episode, and just tell me one thing you're most looking forward to in season 1.
Yeah, I want to hear all the different perspectives from top to bottom about COVID. I mean, that's the biggest thing I want to hear. Listening to the former Surgeon General when COVID was occurring, listening to ASA presidents, AMA presidents, all these people, see how COVID affected them and what they knew.
I'm actually interested. So I love the conversations with those high-level leaders in the U.S. I'm more interested in those that are maybe less well-known, but are extremely influential healthcare leaders. Whether it's AI or technologies, and those major companies that are making those decisions, and making those changes that affect us, but we don't really think about. So I'm excited about those guests that I've already got lined up. I'm really excited to hear a lot of the stories and just getting to know people. Like I said before, I love learning about how people get to where they are, and what drives them. So that's what I'm excited about.
Jeremy?
I'm the kind of person, I just love perspectives. I love hearing how people look at the world, and I love hearing how people look at the world from different perspectives, meaning, big picture, small picture, at a granular level. And especially, we're talking about very intelligent, very well-trained. These are thought leaders. These are people that keep the systems going. And all of these systems are important. I don't want to downplay the reality of it. I mean, the AMA does amazing work. ASA does amazing work. Obviously, the federal government is a huge part of our lives. And all of these people are trying. I really always go into this with the belief that they're trying to do the right thing. And even from our AMA president interview, I didn't realize what I didn't know about their work and how they're accomplishing certain tasks, and what was driving them. Because I think fundamentally all of us in this field really are driven by trying to do what's best for not just our own patients, but the medical community and all the patients in this country and around the world as best as they can. So I think that hearing how that works and understanding it better is always something I'd love to be a part of.
And you said
knowledge is
so sorry.
Yeah,
one last thing. You said around the world. They reminded me we've got a lot to learn from healthcare around the world. There are innovations and technologies that are far beyond what we're doing here in the U.S. And I think we've got some guests lined up that I think will be really interesting for us to learn about how other healthcare systems work. That will really help us just kind of grow.
And Vahid, you close us out. What are you most excited about?
Knowledge is power, but what they don't tell you is who are you getting your knowledge from?
That's true.
And I don't think there's anybody in the U.S. more tuned in medically than the three of you. And I think for us on the outside, right, that want to be plugged in, you got to learn what happened, how do we learn from it, and how do we move forward. And I think that's what I'm most interested in, is gaining the information and the knowledge that, listen, so many people are so closed off to other ideas, whether politically motivated or whatever it may be. Be open to the possibility that the ideas could be coming from the other side of the aisle. Yeah. That's what I'm most excited for, is be open about the information that you're receiving, because some of the information that you've been receiving, and I'm talking to the general public, may have been wrong for the past 5 years. Yeah. And so listen, be open. That's what I'm curious to know and understand and learn from all of you, who are the experts, who've been in the operating rooms, who've been on the front lines, who are connected with these thought leaders, what the real truth is and how we can expand our thoughts and our minds to what's happening.
I thought you were going to say the swag.
Yeah, I like the swag too. I mean, you know, I'm a swag.
That was way better though. Way better.
Well, this has been the medical brief. We're really excited about this first season. Hope you can join us throughout. There's going to be a new episode dropping every single week. Of course, the links in the description below. For Dr. Jeremy Heffner, Dr. Ankit Patel, Dr. Brian Schmutzler, I'm Vahid Sadrzadeh. This has been the medical brief powered by Surgeon.